and the mayors of the 10 largest cities, and also watching the governor's remarks about her plan for the rest of the school year for our students. But anyway, so this afternoon what I'd like to do is make a couple of remarks, or a few remarks about where we stand on testing, and then I'm going to introduce to you Dr. Michael Chang, who's with the University Hospital, and he will tell you what they're doing at the University Hospital and the upcoming relationship that we will have partnering with them. And then I'll call on Bill Sisson, who will talk about the possibilities of applying for the SBA loans and other things that will impact businesses. To my left, you'll see some test kits. When you hear conversation about the rapid serum test kits, which is a blood test where you prick your finger and you put it in a small vial and to determine whether you exhibit symptoms of the COVID-19 virus. This is an indicator. It is not the full test. When you hear about fully testing positive reports going into the Alabama Department of Health, that is typically a nasal test with a swab. So we have these in stock. There's 2,000 of them in the city. But I'm also will tell you that we're hopeful that as we said about a week ago, we think we're on schedule that by the middle of next week, we should be having the swab test that will be available to the University Hospital and possibly the mobile infirmary should they need them, but it certainly will increase the city's capacity for testing. And that's in process, and as we know more about that, we will tell you more. I hope you can tell that there's a lot of collaboration and communication between the hospitals and the city. And just to repeat myself, we are trying to provide a service to the hospitals so that they can better serve you. And at this time, I would ask Dr. Michael Chang, who's with the University Hospital, just to come make a couple of remarks.
Thank you, Mayor Stimpson. Hello, and thank you very much for having us here and for all the work we've done together. As Mayor Stimpson mentioned, we have been working very closely with the city to do a couple of things. Number one, to partner with them on standing up a ambulatory test site at Ladd Stadium. We anticipate this will be happening within the next week, where we can expand our ability to offer what we call the polymerase chain reaction, or the PCR test, which is the definitive test for the presence of the coronavirus. This is important for a number of different reasons. First of all, it gives us the opportunity to provide optimal care for our patients. Number two, it gives us the opportunity to have an idea of what the disease burden is of coronavirus in our community. That's really important for all the hospitals in the community because as you've probably heard on the news and in your news feeds, the capacity of the hospitals in this region and across the United States to care for critically ill patients is very limited. So what we're trying to do is get an idea of what the disease burden is in our community so that we can gauge or adjust the amount, the community activities to try to lower the disease burden to a level that we can provide safe and efficient care within the hospitals. Within USA Health itself, we've been making a number of different preparations over the last 3 or 4 weeks in terms of deciding what the flow of the patients with coronavirus when they get to our hospital will be, which groups of doctors will be taking care of them. We've been spacing out and creating schedules for our physicians and our healthcare teams so that we can always ensure that there are healthcare providers available. And we've actually identified areas within our hospital with which we will be caring for these patients. So with that, I'll turn it back over to Mayor Stimpson. Thank you very much.
Thank you, Dr. Chang. And just to somewhat repeat myself, the mobile infirmary, as we've told you, there will be working through their diagnostic and medical clinics, which is 1700 Springle Avenue, and their facility at Hillcrest and Airport Boulevard. And those facilities, you know, one at 1700 Springle Avenue is already active, and we're in the process of standing up the one on Hillcrest Road. But by midweek, we are hopeful that the collaboration between both hospitals and the city, that we will be taking patients at both locations, but patients at both hospitals and all locations will have to be screened before going to those facilities. There'll be more information, more detailed information, not just me standing behind a podium telling you what it is, but we will write the details of how you will go about getting admitted to one of these locations, so that by tomorrow or Monday you will certainly have a better understanding of what that would be. So at this time I would call on Bill Sisson to come make some remarks about the SBA and other things of interest having to do with business.
Thank you, Mayor. Appreciate that. I am Bill Sisson, President of the Mobile Area Chamber. Good afternoon, everyone. The Chamber, just like the city, is working very diligently to focus on communication with the business community to help them with the challenges associated with COVID-19. We have put a tremendous amount of current information on our website. We're pushing it out through social media. We have changed our programming to help businesses deal with the change in work environments, et cetera, technology, those sort of subjects, using webinars and of course conference calling. And so we're working very, very diligently to do that. We also want to make sure that businesses can access any relief funds that will be coming their way, and we are their advocates for that. The $2 trillion package that will be released hopefully very shortly really gets at some of the biggest challenges for business right now, having to do with employment, with direct grants associated with small business as well as industry in general. Certainly unemployment benefits will be beefed up, and the SBA and their loan process that is currently in place, and we want to make sure that businesses can connect to those loans and to those grants as quickly as possible. I have Danette Richards with me, who is our Director of Small Business. She's going to speak briefly about how we can help them to access the relief funds that will be available to them. So Danette, please, thank you.
Yes, I just want to reiterate that the Chamber has a number of resources available to help businesses in a variety of ways, but what we're really working on right now is assisting companies that are in need of some funding to stay afloat. So you can get more information on our website, mobilechamber.com, but you can also email us directly at sbainfo@mobilechamber.com. We're always updating information as everything's very fluid right now. Things are happening very quickly. Changes are being made very quickly. So just stay up to date with the Chamber, with the Chamber's website, and we'll be able to help you in any way that you need.
We also have a representative of the Mobile Infirmary Health Systems here, and my understanding is that Dr. O'Dowd, would you like to make a couple of comments? Okay, come right ahead.
We have been running an outpatient clinic for the last week, and we have focused on patients who are ill, patients who have a sickness, and there are various purposes. First of all, to identify non-COVID illnesses, because there are many other diseases, and right now none of the health clinics want people with fever in their buildings because of concern for infection. So that's one of the functions of all of these clinics, both the ones that we're running, the ones that will be run at LAD. They will help keep patients with fever out of the general medical clinics, which nobody wants. So that's the utility. That's one of the main utilities of that. When it comes to the different tests, I've been asked to clarify. Now, I'm a cardiologist, not a testologist, but I've learned about these tests, and the basic difference between these tests is the test that we're hoping to acquire as soon as we can test for the presence of the virus. So the test that they get a sample from the nose, they're actually looking for pieces of the virus itself, okay? The tests that we have access to test for antibodies, which is the body's response to the virus. And the inherent problem with that is you can have the virus and the body has not yet mounted a response. So no matter how good that test is, it inherently cannot be as good as looking for the virus itself. That's the test we need, and that's the test we're hoping that we can get.
Thank you very much. A couple other items. Earlier today, I joined probably 150, 200 mayors on a conference call with the Harvard Bloomberg team. We heard top experts from Johns Hopkins, from Harvard Center for Disease and Control. So a lot of information, and then also the sharing of information of what other cities are doing in response to the virus. And so I share that with you to say that listening to the mayors, real time, we feel like that we're in touch with things that we should consider doing depending on our circumstances. But all of the cities are in a different place in this continuum of how they're dealing with it. And based on the numbers that we have, but anticipating that they're going to grow, we feel like that we're doing the correct thing to protect the citizens of Mobile at this time. As I mentioned also, we just got off the phone with the governor, and she was giving us her ideas on things that, and we shared ideas on things that we as a state needed to do. Again, there is a difference of what's going on in Birmingham today, Tuscaloosa, Dothan, and Mobile. And so as plans are developed, there should be not necessarily that we're all treated exactly the same thing, but we should have the flexibility to do some things in Mobile that maybe they don't want to do in Birmingham and vice versa. Also, we have been coordinating. Dr. Asho was not here this afternoon, but as you know, that we're in close collaboration with him. We're already developing plans for what do we do if the hospitals max out with their beds. And so we're trying to come up with the Mobile County Health Department just a plan that really will be submitted to the hospitals for their approval, and we will work collaboratively all together to determine what is the best thing to do. When it comes to the stimulus bill, somewhat like you, we're still learning about it. We do not know all the ins and outs. The most recent meeting I had, right before walking down here, was realizing there are going to be a lot of people that are looking for help. And right now, the staff that people have or that we have internally in the city is probably somewhat inadequate to handle all the questions. And so we will probably be having to ramp up so that we can service you in a timely manner. So having said that, I will be glad to answer any questions. And if I can't, I may call on one of the doctors or Bill Sisson to help me answer. Yes?
Mayor Stimpson, we heard earlier this afternoon that there was an incident of somebody saying that they had been tested and come back negative on a wave bus. What have you heard about this incident?
Having to do with someone on a wave bus being tested and they were negative? Yes, I have not heard about that incident.
Also, do you have any comments on Governor Ivey saying schools will be closed for the rest of the year?
Yes, I know that she has been working on this with the superintendent. I guess he's not the superintendent, he's the director of all of the schools. Excuse me for not knowing the proper term. But they have been working to determine how can they continue the education through the end of the school year so that everybody finishes the school year, I'm going to say, on grade level. And a lot of thought's been given it. So I'm supportive of what they're doing. They have decided that's in the best interest of controlling the spread of the virus, and so I support that.
A lot of people are asking questions on our Facebook page about why you guys have not, you say that you believe you guys are doing the right things right now with not shutting down the city and doing a shelter-in-place order, but lots of folks are saying that they feel it probably should happen before it gets too bad here. I mean, the number of cases doubling from what it was yesterday from 10 to now 18, or the number of cases that positive new cases doubling. Are you worried about being on the wrong side of history a year from now when we have a massive outbreak here and something like that happen?
So am I worried about being on the wrong side of history because we haven't pulled the trigger quick enough on shutting everything down?
Yeah, are you worried yet?
Absolutely, you think about things like that. But based on the information we have today, I think that we've made the right decisions. And if that information changes, we will change with it because it's a fluid, it's fluid environment. So that's my answer.
How's the city preparing for a possibility, because obviously it's going to get worse before it gets any better, as they've said already. How is the city preparing for that? I know they're working on a plan for hospital beds.
So everything that we've said about working with the hospitals on the collaboration of testing, that's one thing we're doing so that we have a bigger database so that we can see where the virus is, we can see what the growth of the virus is. We're talking about the hospital beds, but also trying to make sure that even in the city that the wheels of city government will continue to function. All we are doing is trying to determine how we best operate and run the city based on the circumstances that are changing every day. That's 100% of our focus.
Last week, actually today, so like 1 week ago today, it was Thursday, that's when our first case was announced in Mobile County. Today we're standing at 13 plus cases in Mobile County. Where does that put us on the curve? I wasn't sure if maybe you or one of the doctors might be able to answer that.
Well, I'm going to make a comment, and you may not be able to follow this. I wish I had a graph behind me. Because let's say Monday you test 10 people and you get one hit. So if you got 10%, right? On Tuesday, you test 20 people and you have 2 hits. Okay? What's the difference in Tuesday and Monday? It's doubled, right? But it's both still 10% of the population that you've tested. My point is there is a lot of information being shared. And if you want to show an exponential graph, all you show is the number of hits and you don't tell how many people you tested. So what is the story you're trying to tell? And I would say that today, the information that's being gathered is not telling a complete story. We do know how many more cases we have than we had yesterday, but we have not been recording the information of how many tests have been done. We will have that information, but the scary part of it is that when you show the exponential growth, and if it's not exponential, you're creating fear that you really shouldn't be doing. I don't say that to lessen the severity of this, but I know that there's some information that's being misrepresentative. I'm not saying that's intentional, but it's out there.
So you think that we're kind of seeing these larger numbers now just because the tests are finally starting to get in?
Yeah.
Okay.
Yep.
Lieutenant Governor Ainsworth sent a memo yesterday to the COVID-19 task force in Alabama saying, quote, a tsunami of hospital patients is likely to fall upon Alabama in the not too distant future. Does hearing that concern you for what could be coming our way?
Yes, it does. The question is that Lieutenant Governor Ainsworth made a comment that the tsunami of the effects of the COVID-19 could be coming our way. Does that concern you? Absolutely. It concerns me just like it does you.
But is the city being proactive, or are they going to end up being reactive in this situation as more cases are popping up?
We're being proactive.
There are several churches able to get testing kits for their facility, and other facilities have been getting testing kits. Is there a delay? How are we getting working rapidly, but the city's had somewhat of a delay in getting their kits? I see you have some here, but is it a different mechanism, channels that you guys go through, or how do they were able to obtain testing kits?
Is this comparing us to another city?
No, Church.
A Three-Circle Church? I'm not sure how to, I don't know enough about what they're doing to be able to say that, to answer that question. Okay.
I've got a few questions for the doctor from University Hospital as well.
Perfect. Dr. Chang, come on.
We've heard from a few people that employees of the hospital are being told to use scarves and socks and to reuse masks. Can you confirm if that is accurate or not?
I don't know exactly what you're referring to. I can tell you, though, that the conservation of personal protective equipment is a nationwide problem. And part of that gets to when the other physician was just describing the criteria for meeting testing, for meeting being able to get a test. Part of the reason for limiting the the population in whom we're testing to those with a fever, those with a cough, or those with a history of travel to an endangered area or an area where there's a high incidence of disease, is getting to exactly what you're talking about. We're trying to save personal protective equipment, because every time you perform a test, you burn or use personal protective equipment that could be very well used, and it is very important in the care of those patients once they come to the hospital. So there are efforts going on, not just in our healthcare system, but across the country in healthcare systems and in industry, to find ways to, number one, conserve personal protective equipment or PPE, and number two, to create or manufacture PPE that will protect both the patients and the healthcare workers while we're working through this crisis.
So does that mean that employees are being told to reuse personal protective equipment?
Not to my knowledge.
Okay. Also, is the hospital only using one entrance right now, or do they have multiple entrances for patients versus staff to go into to kind of keep people who could potentially be sick separate?
You can repeat the question.
Yes, so the question is, are the hospitals using multiple entrances and exits, or are they just using one? We have limited, depending on the hospital, we have limited the number of entrances so that we can screen both visitors, patients, and employees as they come in and out of work. There are employee entrances where all the employees are being screened, and there are other entrances for both the patients and the visitors.
Doctor, I know you may not be able to specifically say the number of positive cases at the university hospital, but do you have a rough estimate of the number of people coming in with symptoms that could be consistent with that are being tested for it?
So I can tell you about our hospital systems. Each of our hospitals have about somewhere between 75 and 100 tests pending on patients that are in the hospital or that have been in the hospital. And we have somewhere around, we've performed around 400 tests since we started doing this a little over a week and a half, 2 weeks ago, and about half of those results are back. This, depending on when the test was done, there's sometimes up to a 4 or 5 day turnaround on some of the tests.
An increase every day with more tests being conducted, which would be consistent with community spread happening in our area?
So the question is, are you seeing an increase every day related to the number of tests that are being conducted? The numbers have been so small that the short answer to your question is yes, but the number of tests that have been, number of results that have come back are so small that it's really difficult to make a correlation. Mayor Stimpson's answer was a fantastic answer to your question.
Is USA cutting down on its outpatient procedures, so procedures that are not essential to happen as well, whether that be somebody coming in to get like stitches removed or coming in for
So right, yes.
follow-up kind of a thing?
So the question is USA Health decreasing the amount of what we would call elective surgery and elective procedures that are being done? Short answer to that is yes. We've received directives from both the Alabama Department of Public Health, the American College of Surgeons has issued guidelines, and the CDC has issued guidelines and recommendations as well to cut back on what we would call non-time sensitive procedures. That's a subgroup of what we would call elective procedures. There are some elective procedures that really, although they're elective, they are time sensitive. For example, if you have a cancer that needs to be removed or a condition like that, that could wait a week or two, but really shouldn't wait 2 to 4 months. So those kind of elective essential procedures are still being done, and the ones that time will not affect, for example, cosmetic surgery or bariatric surgery, have been postponed. Yeah, that is correct.
What's being done to keep we heard earlier this week an employee of USA Health tested positive for coronavirus. What is being done to make sure that that didn't get spread among the staff, and also that these people who are coming in who might be at higher risk, who have these procedures that are necessary, are also kept safe?
So you've already, the question is what's being done to prevent staff that may be sick from spreading infection. You've already hit on several of them. One of them is to limit the number of portals through which people can get in and out of the hospital. Another one, which we put in place a couple weeks ago, is screening all the employees and all the visitors and patients as they come in by asking them a number of simple questions. Do you have a fever? Have you had a fever? Do you have lower respiratory tract infection symptoms? Are you coughing? Are you sneezing? Have you been to one of the countries that the Centers for Disease Control has identified as a high-risk travel area? Have you been to one of the areas in the United States in which, for example, New York City, where the infection is at a very high prevalence?
Seeing what's happening in other places like New York City and San Francisco, as a doctor, does it scare you knowing that it could happen here?
So the question is, seeing what's happening in other places, are we concerned? The short answer to that question is yes, we are, and that gets back to the comments that I made earlier when Mayor Stimpson announced that we were going to be working together to test higher risk and other groups of people around the city. Yes, we need to get a better grasp on what the prevalence of the disease is in our region. We need to get a grasp on what the number of patients sick is and which of those patients will need hospitalization or may need hospitalization, because we've got to upregulate or downregulate the hospital capacity of all of our hospitals, whether it's Infirmary, Spring Hill, Providence, or the USA Health hospitals, to be able to meet the needs of the public.
As of now, do you guys have enough beds and ventilators and ICU rooms for people you guys are seeing?
So the question is, right now, do we have enough beds and ventilators? And the answer is yes.
Is there a concern in a couple days or a week that may not be the case, or that would be farther off around there?
So the question is there a concern that we may run short in days or weeks? Yes, there is absolutely a concern because this disease can spread very rapidly. Every person infected is expected to infect up two to three other people, and so it goes 2, 4, 8, 16, 32, 64, and so on. So the short answer is yes. We need to be ready at any time to prepare for the worst and hope for the best.
We're seeing several companies around the country having to add staff just to kind of get through this crisis that we're kind of going through. Are you guys on any of the hospitals level having to add additional staff to keep up with the demand of people coming through the door?
Yes, the question is, are we having to add staff to keep up with the demand? There's two ways to approach this. One way is to add new staff. New healthcare trained staff are tough to come by anywhere in the country. You know, there's a nationwide shortage of nurses, there's shortages of anesthesiologists, of respiratory therapists, physical therapists, and so on. One of the strategies that we've employed is, because of what you had asked me earlier about decreasing the amount of non-essential surgery, and we've also taken steps to make our clinics what we would call virtual clinics. In other words, telephone visits for patients, or Skype visits, or Zoom visits for patients. If that'll allow us to decrease some of the staff that we have for person-to-person visits and for surgery, and we can repurpose some of those staff to help take care of the problem.
Thank you, Doctor.
Yes, sir.
Your time for one or two more questions. Well, I appreciate you coming. We'll be updating you again tomorrow. And as I say every day, we're better today than we were yesterday, and tomorrow we'll be better than we were today. We'll continue to make progress. This is the top priority for all of our healthcare officials and for everybody at the city. So thank you for your attention. Good night.